So thank you very much for the invitation once again. And I'm really sorry for this almost 1 minute delay as I was struggling to get with the link working. And thanks for the introduction. Let me share. I hope you all can see my PPT here. And if you guys have any questions during my presentation, you can always use the chat. I will be here and I can reply them. So I'm going to talk about Canli holograms, and I present it as a new strategy for treatment. It's not like a new method or a new system. It's not something new. It's just the way to prepare it and to present it. So that's what I'm going to show you guys around now. And normally I start my presentations, either classes or lectures, with this quote from Confucius that goes like, reviewing the old and learning the new can become a teacher. But actually this character here, Shi, it's not just teacher, as in Lao Shi, for example, but it means someone that has an occupation or someone that has a job. For example, if I get the character for needle and put together with this one, then I have acupuncturist. If I get the character of medicine and put together with this one, we have the medical doctor. But the thing is, the idea is to really become a good professional on something or a practitioner on something. We must balance this old information and new information. What I'm trying to say is, what is old in our profession? Our profession is most of times already associated with the word traditional. So it's old as in it comes from a tradition. But normally in the Western countries, in our culture in the West, most of the times we use the word old in not a good sense. For example, I'm just seeing my friend Robin here. And so it's just an example, Robin, please. Be easy on me. If I just say, oh, Robin is just that kind of person that only has old ideas. Oh, Robin is just that person that only wears old clothes. Her house is so old. Basically, I'm not saying good things because the word old in Western countries comes with a negative power in most of times. But actually, the term ku in Chinese, which we translate as old, could also be translated as ancient. But in Eastern culture, when we say something is old, it's because it's survived through times. It's different, the idea from the West. So normally when I say reviewing the old, it's not reviewing the outdated information. It's reviewing that information that survived through time. And for us in Chinese medicine, it's our classics of Chinese medicine. They are old, they are really old, but they're not outdated. Because in Western, basically, when we talk Western science or methodology and so on, the new article surpasses the old article. The new science surpasses the old science. So when Confucius says that we need to review the old, because it's the old information, the past, that can guide us to better understanding of the future. But we shall, as Chinese medicine practitioners, study and learn the classic material. But we cannot, and I should say must not, shut our eyes to the new information, what could be the new technology. For example, we are just exchanging information, which is ancient material of Chinese medicine, but with a new technology of Zoom, of virtual classes. So in Chinese medicine, we need to balance this, or as I say, as the motto of my college, tradition and modernity. In China, they are using more and more this sentence. We need to balance the heritage and the advances of Chinese medicine. That's why I personally advocate not to using TCM, traditional Chinese medicine, because it's a balance of ancient and modern, ancient, classical, and contemporary Chinese medicine. Okay? And this way, we can become a good practitioner. So Canli method, as I propose here as the basis for the lecture, integrates these classical principles of Chinese medicine into daily clinical application, which is nowadays, so we balance the old and the new. So a deep understanding on how to use these essential principles is extremely useful for improving the therapeutic effects of Chinese medicine on each different branches of this way of thinking health and disease in people. So Kali method, it's based on a comprehensive strategy for treatment, and we can apply for acupuncture, for holograms, which is the topic of this lecture. We can apply for Chinese herbs, for food therapy, for massage, for qigong, and so on. We can apply for different strategies for different moments as well. And this is what I call the tree of Chinese medicine. This tree of Chinese medicine represents the way we apply it. So the trunk, we can read in Chinese, Zhongyi, which is Chinese medicine. Then we have the branches. And these different branches is exactly where we apply our knowledge. So each of the branches, we have the therapeutic use of Chinese medicine. So we can use the herbs, we can use the food, we can use acupuncture, but we are all talking about the same and one tree. And in order to have better fruits for this tree, in order to have better results with our patients, we must nourish our roots. And our roots are the classical books of Chinese medicine. So nourishing the root, we can improve the tree. Nourishing the root, we can get better effects on our patient. This is the basic concept. And just analyzing a little bit further this image, we have on the right side the so-called internal branches, not as internal as in qigong practice, but internal as the treatment starts from the inner to the outer part of the patient. We put something inside, as in herbs and as in food. And the left side, we have most of the external branches where we treat from the exterior in order to get effects in the interior. And the basis for applying Kali method is a deep understanding of the important concepts of balancing water and fire. Really, Kan and Li in Gua concepts in the Bagua, and Yin and Yang. And this application is particularly important when we do it in accordance with how to use these concepts in different parts of our body. Remembering that when we talk about, for example, this image of the Tai Chi, we need to remember that this Tai Chi picture is actually a 3D thing. So we need to understand how to balance this Tai Chi image in different aspects, different parts of our body. And when we understand it, we need to remember this quote from not just Chinese medicine, but Chinese culture. In Chinese, go Tian Ren He Yi. Tian is heaven, or the sky is heaven, and Ren is the person, human being. He, as in He Gu, the acupoint is unite, and Yi is the number one. So heaven and human united as one. This is a basic concept that we use a lot in different areas of Chinese culture and Chinese medicine as well. But here, talking about holograms, it becomes even further important. So when we talk about Chinese medicine in general, normally we say Chinese medicine is a holistic approach. And this is the sentence normally used in China to reference this holistic approach, because we see the big picture, heaven, how it's integrated with the small picture, the person, how the nature, as in heaven, can affect the inner or the smaller part of this quote, which is the person. So our ancestors in China, they looked at nature and they saw wind, they saw the rain, they saw the hot weather, the cold weather, and then they, understanding how these different changes on the weather could affect the nature, they described it how it could affect also our body. That's why we have wind, cold, dampness, dryness into our body, because we are relating to nature. So what happens outside can affect our inside. And nowadays, we can also understand, and not just understand, but we can see in reality how the changes the human, the people do can affect nature. So we can see, for example, climate changes. But when we talk our body, we as professionals, we are trained to look to the whole body. So this becomes the big picture. But when we are talking about hologram, for example, we are just talking about looking to the ear. This becomes the small part. So heaven and human united as one can also be applied to our body, where a specific area of our body can reflect the whole body. We can use points in different parts of our body to treat one specific area, but we can also use one specific area to treat the whole body, because in Chinese they would say 天然合一, because the small picture and the big picture, the small part and the big part, all the so-called micro and the macro, they are united, they are together. And we as Chinese medicine practitioners, we need to look at everything through the lenses of yin and yang. So when I talk about human and heaven united as one, we are talking about how yin and yang manifests in the body and in the nature or in the specific part of our body. And we need to look at it to better understand how it's reflected and how it influences. So this is a picture of the Milky Way. You can Google this kind of picture. It's open source, it's open. And we can see this a spiraling thing, and then we can see two lighter parts, but we can look at it using what I so-called the glasses of Chinese medicine. We can look at it and we can see the Tai Chi there. Of course, it's not a perfect overlay, but we can see that there is some influence, some of the ancient knowledge that we can understand there. What I'm trying to say is that when I look at somebody as a Chinese medicine practitioner, I shall look at this person and to see how yin and yang are manifested on their body. We need to look at some disease and understand how the yin and yang are manifesting on that person. This is really important. And as yin and yang is the fundamental principle and most important theory in Chinese medicine, underlying all physiology and pathology and treatment, we need to reinforce our knowledge of yin and yang in order to apply any kind of treatment. So the earliest reference to yin and yang can be traced back to the I Ching. And I just shall say that Professor Sampson, that would replace me if I could not enter on time, he is a teacher on I Ching applied to Chinese medicine. It's really, really important and nice topic, and I recommend it for anyone that really wants to understand how to balance those. So we can understand the yin and yang through the lenses of the I Ching. We can understand the yang, and we need to apply it for the Chinese medicine. So here we have the yin represented as the complex and the simplified character in blue. Then we have the yang represented on the also complex and simplified character. But also we have how they appear in the I Ching as what people call the broken line or the continuing straight line. So the first thing, you can all see that the characters, either the complex or the simplified, they start with this radical, which is related to a mountain. So everybody knows that. So we need just to recall that every time we are talking about yin or yang, we are talking about basically how we look at things, how we look at, either we can say the same thing or the same category of things, but using different perspectives. So here we are talking about looking at a mountain and observing the shady, the cloudy, the darkest side of this mountain, or looking at the sun, the brightness of the mountain. But we are talking about the same mountain, but two different perspectives. And the simplified, we have just the mountain and moon, the mountain and sun, but we still have the same idea, meaning the moon with in the character reflecting the dark part in opposition to the brightness of the sun. So if you understand this as a dark, as cloudy, we can also say that this is not a broken line, but it's the same line with a cloud on it. Please reply me on the chat if you can see what I'm trying to explain here and if it's making sense when I'm trying to explain it. So what I'm trying to say is that the straight line of yang is also reflected as the yin, but with some shady part or a cloudy that makes it not possible for us to see the whole picture. This is the yin, the yang. We need to understand them together and how we can apply in the body. So in order to see the importance of this, we can go back to Suen chapter 5, for example, where it explicitly says what is yin fire is yang. Yang is qi, yin is flavor. So when we talk about water is yin, fire is yang, is the utmost representation. So if someone asks, what is the utmost representation of yin? It will be water. What is the utmost representation of yang? It will be fire. But then it goes, yang is qi, yin is flavor. Flavor comes from the food. Flavor comes from the herbs, something that is material. So here we are talking about the yang is more immaterial and yin is more material, more dense. We can also say that yang is related to function, yin is related to anatomy. So when we are talking about improving the health of our patient by moving qi, we are talking more on using yang aspect of the treatment, because we are talking about moving, we are talking about function, we are talking about qi. So that's what I'm trying to say. I'm not saying that yin is not important. Of course it is, but it's the dense part, is the inner part, is the more anatomic part, and one needs the other to be balanced. So as yin and yang can be understood from the I Ching, we can also look at them through the lenses of the Ba Gua. And this way we have Kan and Li as the most important representations, as we can see also as pointed on chapter 5 of Suen. So Kan is the name of the trigram representing water, and Li is the name of the trigram representing fire. So here in this picture on the left, we have the trigram Kan, and on the right, we have the trigram Li. And we can say that the most important representation of yin in water also has a yang line inside. So the most important, the utmost representation of yin must have a yang line. And when we talk about fire, we are talking about the most yang representation, but in order it to be applicable, in order to be clinically viable, it must have a yin inside. We must also recall that cold water is not functional water. That's why we need to warm it. Then we have the yang line inside. But too strong fire can become dangerous to our body. So we need to have water not to cool down the fire, but to restrain the fire. So one needs the other to be balanced. And here, in order to see the importance of what I'm trying to point here on the Li Jing, we have this sentence. Thus, in heaven, sun and moon are water and fire. In the I Ching, Kan and Li are water and fire. In medicine, the heart and kidney are water and fire. In alchemy, essence and qi are water and fire. So you're talking about which are the utmost representation of yin and yang. So we have in heaven, sun and moon. Then we have in medicine, we have the I Ching. So when I say Kan-Li method, I'm talking about yin and yang and how to apply it to the body. And it goes on. It says that now the kidney is water and the generation of qi inside water is precisely the true fire. The heart is the fire and the generation of fluids inside fire is precisely true water. The mutual storage of water and fire within each other, this is where the utmost Tao is located, and this is what any physician should first examine attentively. So here, when it says that kidney is water, okay, but it says that there's the true fire inside this water. What is this true fire? What is the name we, as in Chinese medicine, what is the name we use to reference this true fire? And when it talks about the generation of fluid inside fire is precisely true water, what is this true water? So for the heart, this true water is the blood. Inside the heart, the blood has a yin nature, and it helps the heart to control the fire in order for this fire to be, for not being over. The true fire is what we call the Mingmen, and different texts says that one anatomic kidney is real kidney, the other one is the Mingmen. Nanjing says that the Mingmen is one of these, but afterwards it goes in the middle of the kidney. So here is just on how to use this information and use the trigram Kan to recall this importance. So then we have the kidney, the anatomical kidneys, and in the center we have the true fire. This is Mingmen, the true fire that comes from the yang nature in order to improve the quality of the water. And this could also be understood as a way of applying the hologram idea. So I get one information and apply it in a different part of our body. So we can say that the kidney area would be a holographic representation of the trigram Kan. But you can also use this to memorize and recall the information using the holographic transposition of the trigram Li into the heart area, where we have the heart as the fire organ, but we have the blood, we have the true water inside. So this is a way for us to apply this information. And we need to remember, using once again the representation of Tai Chi, on the left, we have the representation that has the yang moving upwards and the yin going downwards. When we talk about yang moving upwards, this is how it goes and accumulates in heaven. That's why heaven is represented by the most yang position, and earth, the land, the most yin position. But actually, during the day, this Tai Chi, it's not in one fixed representation. It moves. So what we are watching just now is a picture, but actually the movement of Tai Chi is as a movie. It goes on and riding. So as a Chinese medicine practitioner, one of our jobs is how to reposition the yin and yang and how to apply it in the body. So for example, if you just have the fire on top here and water below, by their own nature, the fire would burn upwards and the water will be drained downwards. And when the fire goes up and the water goes down, they separate from each other. And this can be one of the patterns in Chinese medicine, the non-communication of water and fire. So what we need to do as Chinese medicine practitioners, we need to understand how to rotate it. And then when we rotate it, and then we move fire from the top to below and let the water from below go upwards, then we have the fire warming this water. And when we have the fire warming this water, it can get to the boiling point and then it becomes vapor. And vapor is one way to translate qi. So in order to better produce qi, we need to rotate this Tai Chi. We need to understand how to move this yang to the yin area and the yin to the yang area. Okay, this is basic introduction of Chinese medicine, but we see that we have, for example, selecting upper points to treat lower parts of the body, or the opposite, selecting lower points to treat upper parts of our body. This is another way to say that we need to use yin to treat yang and yang to treat yin. We need to make this rotation, and that's why we use upper points to treat lower parts of our body, because as we consider this movement, we are permitting, allowing this rotation to occur, and this is where the movement and the effects will become clearly for us. Another important theory that we use in Chinese medicine is the 5 movement theory, or 5 phases. I don't like 5 elements, but that's me. This theory plays also a really important role on understanding physiology and pathology, as long as presenting as an important treatment strategy, not just as selecting like the mother point or the child point, but understanding how it affects our body and how we can use it for balancing the body. But one thing is that we need to look at the 5 movements as a continuum theory, as in relation to the yin and yang. That's how we're doing Kanli method. So this is the Tai Chi symbol. This is the Tai Chi with the trigrams, and this is the Tai Chi with the 5 movement representation. So you can see that this is not the most common seen representation of the 5 movements, but this is the most, we can say, classical representation. If you go back to the first chapters of Su Wen, for example, this is the representation you're going to see. This is the 2 most common pictures or images related to the 5 movements. On the left, we can see that Earth is in the center, And on the right, we can see that there is nothing in the center, and all the fives are represented on the outside part of the Tai Chi. But remember that yin and yang is the most fundamental theory in Chinese medicine. So it's the basis. If you consider the knowledge of Chinese medicine as a pyramid, yin and yang is always the basis. So every other theory we need to study, we need to put it on top of the first one. So yin and yang is the most important basis. So when we learn 5 movement, it should be point on top of yin and yang. And of course, it must be in accordance with the yin and yang theory. Then we put, for example, the Zhangfu theory, which should be in accordance with the 5 movement theory and also with the yin and yang. And then we put the channel theory and so on and so on. What I'm trying to say is that when you look to the picture on the left, there is a perfect proportion of yin and yang on each of the 5 movements. So wood is related to spring. It's when the warmth is starting. So it's the beginning of the growing of the yang. It's related to generation in Chinese medicine. Then we have fire, which is related to summer. It's the utmost yang. Then the yang becomes less and less, and the yin becomes more, it becomes appearing more and more. Then we have autumn. That's why we have metal. When the yang is in its minimum, which is now in the north hemisphere, the yang is its minimum, so the yin is appearing more and more. Then we have the water. We have 4 seasons, we have 4 directions, but we have 5 movements. So once again, we have 5 movements, 4 seasons, 5 movements, 4 directions. So these fifths must, in order to really demonstrate 4, this is just for memorizing. So in order to make 5 look at like 4, it goes to the center. It goes to the center. So earth is in the center. It's nothing new. Once again, the first chapters of Suen also talks about the north, the south, the west, the east, and the center region. So we are talking about directions. When you look to the right picture, we are talking more on the cycles, the generating cycle and the controlling cycle, Shan and Ke. That's the main use for this representation. Some people call the pentagram. But when we are talking about the basic Chinese medicine knowledge, the most fundamental theories, we are talking about the left picture. And this left picture is really important for using in different holograms in Chinese medicine. Another important classical principle that is part of Kanli method is the so-called San Cai, or the 3 power or 3 potency, which is Tian, Ren, Di. Tian, heaven, the utmost yang. Di, as in earth, the soil, the land, the utmost yin. And here is man, but it's not man, it's human. It's a person in the middle. So we have the utmost yang, we have the utmost yin, and we have us in the middle, as we need to balance yin and yang. So this is representing the Sansai theory through the lenses of Tai Chi. Please record and pay attention that everything I'm talking about, I'm trying to recall in our minds that we must look it through the lenses of the Tai Chi. Either the representations of different parts of our body, either the 5 movement theory, either the Sansai, which is the utmost yang, which is the utmost yin, and what is in the center. That's why balancing fire and water as the most important opposing forces, we need to consider the center. So in order for me to do this movement, I am actually moving from this. There is a pivot here. This pivot makes it possible for me to rotate it. So when I'm talking about this Tai Chi, I can hold the yang, I can hold the yin, and then I can move it, or I can hold it in the center. And when I hold it in the center, then I can rotate it. I'm going to show you guys again. I can hold it in the center and then I rotate it. It's easily. So from 2 become 3. So we have fire, we have water, and center we have earth. three very important concepts. And here is an example on how to apply this to the body, talking about, for example, the depth of needling. So when we are talking about the yang stimulation, we are talking about very superficial. When I talk about yin stimulation, we are talking about deeper. So we have from the skin to the bones. We have the 5 movements. We have the 5 zang. We have the 5 tissues. So the most superficial one is the skin. Then we have blood vessels. Then we have muscles. Then we have tendons. Then we have bones. So most of times we need to the muscles, which is balancing yin and yang. But when we want to treat something that is a little bit more yang, I'm not just talking about heat, but a little bit more yang in general. For example, on the fundamental substances or the 3 treasures, Shen, which can be translated as mind or spirit, is the most yang between these treasures. So when we're talking about using acupuncture for treating Shen problems, most of the times we are talking about needling superficial points. For example, Dalin, superficial, Shenmen, superficial. We are talking about Chongchong, superficial. We are talking about Yintang, Shenjing, Pahui. They are all superficial points. And superficial needling is good for treating yang nature situations. Either yang nature as in superficial situations or related to Shen. But when we are talking about deeper inner situations such as Jing, which can be translated as essence, we need to go deeper. So we needle the points deeper. And when we are talking about micro systems of acupuncture, most of them are, or a lot of them are a little bit more superficial. Some of them are deeper. This way you can understand, oh, this one is better for acute conditions. Oh, this one is better for chronic conditions. This one depends on how I needle them. So you can understand it through the lenses of yin and yang, or as I say, through the lenses of Kan Li. So balancing yin and yang through the understanding on how and where the problem started and choosing the best targeting areas. This way, we can move the body towards a regular balance. As we can see in 1967, yin disease moved to yang, yang disease moved to yin. So this is very interesting because if the yin disease moved to yang, it's not in the yin anymore, it's already moved to yin. We can use the yin, but we need to recall that it's already moved to yang. It can be understood as up and down, right and left, front and back, inside and outside. This way we can apply this concept in the body. But every time we talk about up and down, right and left, no matter, the chi from up to down must pass through the center. The chi from left to right must pass through the center. So that's why understanding the concept of center is really important for any practice. It's not just me saying. If you guys, for example, go back to Shanhan Lun, a lot of formulas on Shanhan Lun has present herbs that focus on treating the center. Even it's not a center treating book, it's a Shanhan book. But when we see the formulas, many of the formulas, for example, has Gancao, which is licorice. We have Guiji or Zhou which is cinnamon. And we have Shenjiang or Ganjiang sometimes, which is ginger. And these herbs has the characteristics of warming the center. So the center is really, really important. In short, for most part of the treatment, it's very important to consider the situation of the center. And we can see the center as earth, also the center as spleen and stomach, but also anatomically as the abdominal area or as the navel area. So for the use of acupuncture, we suggest to select points in the upper and lower part of the body, but also remember about the abdominal area. And I shall reinforce this sentence once again, because nowadays more and more practitioners and teachers goes that, oh, only distance needling is correct. Local needling is not correct. Local needling is not the best type of acupuncture. And when we go to China, they see using the combination of local and distance. What I'm trying to say is distant is very good. Balancing the up and down, low and left, it's very good, very good. But we need to remember that for one stimulation from the hand to reach the other foot, it must pass through the center. If there is a blockage in the center, it can limit how the stimulation from the upper right goes to the lower left. So we need to understand that sometimes the strategy of treating the center must be recorded. And the basis for applying the Canli method could be simplified on the 3 characters, ping, tong, he, because our target for the balancing the patient is really important, but not the balance of any cause, because balance could be understood as a static balance. In Chinese medicine, we talk about a moving balance or dynamic balance. And this dynamic balance, it's just achieved when we have free flow. If there is no free flow, there is no dynamic. But this could be dynamic like this or dynamic like this. But this is with no harmony. So we need to have balance. That's our target. But also we need to remember that the balance must be achieved with the free flow. And the balance and free flow should be expressed in an harmonical way. So this is Canli, and then we're talking about holograms. Dr. Ralph Allandale was the first to use the term micro-acupuncture. It was 1975. And he separates these 2 systems of acupuncture. He says that one is the classical system with the points and channel all over the body. And the other is any system which a definite part of the body, such as ear, for example, manifests reflex to all the main channels and organs in the body. Nowadays, it's very common to use the term hologram to identify the microsystems of acupuncture. But the definition of holograms should be recorded as a 3-dimensional image, like, for example, colorful security emblems we see in credit cards or some packages or banknotes. There are holographic marking. And one of the characteristics of a hologram is that it's a record or presentation of an image in 3 dimensions. And from the Greek, writing graphos representing the whole. Holograms have this characteristic that each part of the hologram has the information of the whole. So a small piece of a hologram have the information of the entire picture. And this is the concept of, for example, ear acupuncture. A small part of my body have the information of the entire body. Specialists have highlighted that the concept of microsystem also could be understood bringing landing theories from different other science. For example, from the mathematics, we can understand it through the concept of fractal. So it has been mentioned that acupuncture microsystems are one of the manifestations of the so-called fractalization. So the resolution of a microsystem and its influence on the organisms depend on the location of its projection on the surface of the body, or mucosa and so on. And the influence is most effective at points related to the classical acupuncture channels. So if you can see the representation of a hologram in a part of the body that has many curves, such as the ear, we need to go deeper on understanding how it represents the body. If it's in a flat area, it's easier to represent because a hologram is a projection. We core this idea. A hologram is a projection of the whole body in the surface of the skin. If there are many curves, this projection cannot be so clear. If it's a straight surface, the projection can be clear. This is just one example of fractalization. It starts with just a triangle, and each division also has a triangle, but sometimes the division is so much, it's so big. I mean, the number of sequence that it's being divided and projected once again, that the resolution gets difficult for us to see. We can see the triangles very easily in the 2, 3, maybe the third picture here. But when it goes on more and more divisions, it becomes less clear. It's because the projection should be in a bigger picture for us to see the first triangle. So the concept of resolution is very important. The smaller the micro system, the smaller the hologram in our body, the less resolution it has. Okay? And it was around 1973 that Dr. Jiang Yingqin from Shandong, where I graduated, he presented the essivo acupuncture concept. Essivo is the short for embryo, containing information of the whole organism, and he represents that the whole body could be seen and understood through this second metacarpal bone area. So this is his concept. This theory also reminds us that in the embryonic period, each of our cells has the inherited potential to become a complete being. We can lose this potential, but in his theory, we can use needles to stimulate this potential. We can use needles in specific parts of our body in order to recall our cells, recall our body of this inherited potential in order to treat distant area. So the smaller microsystem represents the bigger microsystem, which represents the bigger picture. So, for example, I have the whole body, then I have my head could be related as a microsystem, but not just the head. We have like the cheeks as one microsystem, we have the tongue as one microsystem, we have the nose, we have the eyes, we have ears. Another example, we have the hand as a very important microacupuncture system. But we go for example, as a sujok, which is one method of acupuncture, then just one finger can be a whole microsystem. If you go deeper, just one phalange of the finger could be a microsystem. Because if he presents his information and we use it, we see that the bigger can be represented the smaller, and this smaller could be representing the smallest one, and so on. Which he's trying to say is that as in the first divisions of the cells in the embryonic period, if one cell separates, it can become a whole organism. If you go back to the smallest microacupuncture system, we can still stimulate the whole body. And how it can be understood through the lenses of Chinese medicine. We can see it using the understanding of the Chinese medical theories, as I mentioned, yin and yang, 5 movements, sun, psi, but also the channels. Normally, what we see on the atlas is just here, number 5, the Jinmai, which are the channels where the acupoints are located. So there are many other layers that sometimes we know, sometimes we don't know, sometimes we learned it and forgot. But here, we need to remember that all the areas in the body could be seen from the most superficial layer of channels, which is the cutaneous zone, the people, and it reflects all the inner channels and collaterals too, representing the Zangfu. Here is an example of the lung channel. So we have in white, we have the cutaneous region, then we have the channel sinew, we have the main channel, the divergent channel, the internal branches of the main channel, then we have the collaterals. This is just for the lung. We have 12 main channels, 12 cutaneous regions, and so on. So when we put those together, then we can really see the very deep and important connections of these channels and why one channel communicates with the others. And I'm not even talking about the 8 extraordinary vessels, just talking about the regular channels and how they divide. Here is, as we are talking about holograms, here is an example. For me, as a Chinese medicine practitioner and also a teacher, it's not good just to say, oh, the ear is a reflex of the body. Okay, Western medicine also says that sometimes. But as a Chinese medicine practitioner, the effect from the ear to the body must go through the channels. That's how we must understand and use it. So here is just an example of looking at the ear and seeing the channels that pass through the ear and how this can really affect the whole body. So in practice of microacupuncture, there's many possibilities for the instruments. We have the filiform needles, other, and so on. So I'm just talking about a few. Regular body acupuncture needle can also be used for the treatment of microacupuncture. And it's really good because it has the advantage of allowing us to do some manipulation. So for example, I can insert the needle and I can do rotations of the needle. And this can improve the effect, even in the ear, but also in abdominal and other microsystems. But just giving an example, I'm going to talk about 3 seeds. Seeds are really nice and and easy materials for us to use for microacupuncture, mainly on those microacupunctures that has very superficial layer of tissue, such as the ear, such as the hands, such as the foot. Seeds are really, really nice. Or for using in other parts of our body, we can use it, but then the stimuli is a little bit weak, but for child is okay. The most frequently used seed in the practice of microacupuncture is the semen vacaria, which is a Wambu Liuxin in Chinese medicine, and it's related to the substances to the tonified blood. It has the taste, the bitter taste, spicy and sweet. Nature is neutral and relates to liver and stomach. But remember that any seed, the first thing is how it pressures the point. Then we have the effects. So when we talk about tonifying blood, and we talk about moving, this is nice because bitter quality moves blood, moves downward. Spicy spreads and moves, so it's quite nice. But if we need to tonify a little more, to warm it a little more, and to move it a little more, then the mustard seed is better than just the Wambu Liuxin. So this is Bai Zhi Zi, from the character of warm substance that transforms phlegm. So it's very nice for people that has conditions that is related, for example, to cold and dampness, cold and phlegm. Bai Zhi Zi is quite nice. It's spicy, so it moves you in a strong way. It's warm, and it relates to the lung and stomach. So stomach representing the inner part, lungs representing the outer part. It's quite interesting. We need to be careful with patients that are very allergic to the mustard, or patients that are really weak because like weak skin, or very soft skin, such as old patients. Then we need to be a little bit careful with the spicy. But then we have another one, which is Lai Zi, the radish seed. In Chinese medicine, it's related to the category of substances that alleviate food stagnation. So if you want to improve this quality in patient, improve the food digestion, or relieving food stagnation, this could be one of the options. So I mentioned 3. We can talk about others, such as magnets and so on, but these 3 are really important. We can also use this kind of instruments in order to pressure the points. They are quite good. Or using this one that also has a spring inside, so you can pressure, and the spring absorbs and make the stimulation the same in different areas. Okay. So once again, it's worth highlighting an important concept is that concept of reflex. Reflex knowledge is really important. That's why the holograms are so effective and rapid and quick on getting the effect. But as a Chinese medicine practitioner, understanding the reflex is one part we must understand through the channels. We have the so-called organic cutaneous, or from the inside to outside. It means a problem inside reflects in the outside. So it's diagnostic reflect, as we see, for example, in the tongue inspection or the pulse take inspection. We're talking about something inside reflecting on the outside. But you can also use the cutaneous organic, or the outer to the inner. This is a trigger that brings the effect from the outside, stimulating the inner part of the body. And once again, when we look to any microacupuncture, we must look at it through the lenses of Chinese medicine. So we need to understand how to position the Tai Chi. So in order to understand it, I need to see, oh, the Tai Chi is in the regular position or in an upside down position. When we talk about ear, we are talking about the representation of a fetus in an upside down position. So this is the Tai Chi. So here, for example, we see a lot of people using just the ear apex for treating excess, which is quite good. But when we see the representation of the body bleeding, what I call the lobo apex, or the LX6, depending on the books, this lower point of the lobule, we can also bleed this point because it represents the most young part of the ear. This is just the same example using the trigrams Kan and Li. This is, sorry, it's in Portuguese, but I must look to the ear and understanding where is the upper jaw, where is the middle jaw, where is the lower jaw. This we need to understand. It's rotated upside down once again. This, sorry, Portuguese, but here the 5 movement is how we see and represent the 5 movements in the different parts of the ear. Okay? Let's continue. So this can be done to different microsystems, not just for the ear, but this is if we say the first map of ear acupuncture, this is the one representing the 5 movement in the so-called classical representation in the ear. Okay, so this is the second metacarpal bone representing the body from the upper part to the lower part. This is the same looking at it through the lenses of the Tai Chi. And then when we talk about some master Tung acupuncture practitioners, such as Professor Yang, which is one of the most important teachers from direct lineage, he talks about this as the micro Tai Chi for Tung acupuncture. And you can look at it once again in the regular position or the upside down position. This representation cannot be called as the Lingku Tapai system. Some people use this term. Lingku Tapai are the acupoints, but you can look at it as the Tai Chi or reversed Tai Chi. You can also look at the forearm, and the forearm can also be understood as a representation of the whole body. So here is separating the upper jaw. We are talking about the area near the hand. Then we have the middle jaw and we have the lower jaw. And in the center of it, we have earth. This is also a way to look at the body as a hologram representation, or we can use it as a Bagua representation. So we have the same idea from the center. Then we have the 8 points around the center area. We can do it through the abdominal area. Then you have the Tai Chi. Then you have the 5 movements. And recall that this can also be understood and applied for the Bagua. But it's not just for the abdominal area. If we go a little bit further, this can be understood for the navel area as well. Yesterday, I was just teaching for a Spanish class about navel acupuncture, and this is the same concept. We start from the abdominal representation, and then we can squeeze it to the navel. Or if we do the opposite, we understand from the navel, and then we move outward to the abdominal area, because the concept and the basis are the same. So, getting to the end, I hope we could conclude that the Kandi method can be used for different conditions, and we are based on the principle, in the classical principles of Chinese medicine, trying to focus and going back to the origins and roots of our medicine in order to solve problems. The application of Kandi method can take place through different therapeutic modalities, and it's up to the professional to choose the best approach for any and each specific case. I try to present how I understand the holograms and how I think about them through the lenses of the Kandi method, and this would be just a way for you to think about more and more how we can do it clinically, okay? Once again, I need to say Kandi method is not something new. No, it's just my way of understanding and how I try to make it sense, because a lot of times in Chinese medicine, we hear about something, but we cannot figure out exactly the background of that. So I just try to put in words or in text the way I think of Chinese medicine and the way we use in our college and the way we treat our patients. So, muito obrigado. This is Portuguese. Muchas gracias. Thank you very much. And Fei Chang Kanxie. So I try to take all the audience here. Thanks once again, Robin, for inviting. Thanks all the audience here and all the speakers. I check it and the topics are pretty interesting. Thank you very much.
Thank you so much, Dr. Filho. Does anyone have any questions before Reginaldo goes on his day? Any questions? This is a fascinating topic and can be used in so many different ways. Any questions? No questions.
And last time I taught in 5 branches, I said, and I will say, I'm doing my best to speak English. Of course, it's not my mother language. I can promise you guys in Portuguese, I'm much more fun and much more interesting, but I'm doing my best to be a little bit interesting in English as well. So if you guys have any questions, you have my email as well.
Excellent.